Presentation by Salisu Bature Shuaibu on application of information communication technology in teaching and research, CHTE 709, by Salisu Bature Shuaibu, matric number CPC/FHS/2025/4764. Topic: Cytomegalovirus (CMV). Cytomegalovirus is a common virus. Once infected, your body retains the virus for life. Most people do not know they have cytomegalovirus (CMV) because it really causes problems in healthy people. If you are pregnant or your immune system is weak, cytomegalovirus is cause for concern. Women who develop an active CMV infection during pregnancy can pass the virus through their babies, who might then experience symptoms for people who have weakened immune system, especially people who have had an organ stem cell or bone marrow transplant. CMV infection can be fatal. CMV spreads from person to person through body fluid such as blood, saliva, urine, semen, and breast milk. There is no cure, but there are medications that can help treat the symptoms. Symptoms of cytomegalovirus. Most healthy people who are infected with CMV may experience no symptoms. Some experience minor symptoms. People who are more likely to experience signs and symptoms of cytomegalovirus include newborns who become infected with CMV before they were born, that's congenital CMV. Infants who become infected during birth or shortly afterward, that is prenatal CMV. This group includes babies infected through breast milk, people who have weakened immune system, such as those who have had an organ, bone marrow, or stem cell transplant, or those who are infected with HIV. Babies. Most babies who have congenital cytomegalovirus appear healthy at birth. A few babies who have congenital CMV who appear healthy at birth develop signs over time, sometimes not for months or after birth. The most common of these late occurring signs are hearing loss and developmental delay for babies. A small number of babies may also develop vision problems. The following signs and symptoms are more common in babies who have congenital cytomegalovirus and who are sick at birth. Premature birth, low birth weight, yellow skin and eye, that is jaundice, enlarged and poorly functioning liver, purple skin, splotch or a rash or both, abnormally small heads, microencephalopathy, enlarged spleen, pneumonia, seizure. People who have weakened immunity. If your immune system is weakened, You might experience serious problems that affect your eyes, lungs, liver, esophagus, stomach, intestine, brain. Healthy adults. Most people who are infected with CMV who are otherwise healthy experience few if any symptoms. When first infected, some adults may have symptoms similar to infectious. Mononucleosis includes fatigue, fever, sore throat, muscle ache. Causes of cytomegalovirus. Cytomegalovirus is related to the viruses that cause chickenpox, herpes simplex, and mononucleosis. CMV may cycle through periods when it lies dormant, and then reactivate. If you are healthy, CMV mainly stay dormant. When the virus is active in your body, you can pass the virus to other people. The virus is spread through body fluids, including blood, saliva, breast milk, tears, semen, and vaginal fluid. Casual contact does not transmit CMV. Ways the virus can be transmitted include touching your eyes or the inside of your nose or mouth after coming into contact with the body fluid of an infected person. Number 2, sexual contact with an infected person. Number 3, the breast milk of an infected mother. Organ, bone marrow or stem cell transplantation or blood transfusion. Number 5, birth. An infected mother can pass the virus to her baby before or during birth. The risk of transmitting the virus to your baby is higher if you become infected for the first time during pregnancy. Risk factors of cytomegalovirus. Cytomegalovirus is a widespread and common virus that can infect almost anyone. Complication of cytomegalovirus infection vary depending on your overall health and when you were infected. Healthy adults. Really, CMV causes a healthy adult to develop mononucleosis. Other rare complications for healthy adults include problems with the digestive system, liver, brain, and the nervous system. People who have working immunity. The complication of CMV for people who have working immunity infection can include vision loss due to the inflammation of the light sensing layer of the eye, retinitis. Digestive system problem including inflammation of the colon, colitis, esophagitis, and liver hepatitis. Nervous system problems include brain inflammation, encephalitis, and pneumonia. Infants who have congenital CMV. An infant whose mother first become infected with CMV during pregnancy is more likely to experience complications. Complications for the baby can include hearing loss, intellectual disability, vision problem, seizure, lack of coordination, weakness, or problem using muscles. Prevention. Carefully, hygiene is the best prevention against cytomegalovirus, that is CMV. You can take this precaution. Wash your hand often. Use soap and water for 15 to 20 seconds, especially if you have contact with the young children or their diapers, saliva, or other oral secretion. This is especially important if the children attend childcare. Avoid contact with tear or saliva when you kiss a child. Instead of kissing a child on the lips, for instance, kiss on the forehead. This is especially important if you are pregnant. Avoid sharing food or drinking out of the same glass as others. Sharing glasses and kitchen utensils can spread cytomegalovirus. Be careful with the disposable items. When disposing of the diapers, tissue, and other items that have been contaminated with bodily fluid, wash your hands thoroughly before touching your face. Clean towel and the countertops. Clean any surface that come in contact with the children's urine or saliva. Practice safe sex. Wear a condom during sexual contact to prevent spreading cytomegalovirus through semen and the vaginal fluids. If you have working immunity, you may benefit from taking antiviral medication to prevent cytomegalovirus diseases. Experimental vaccines are being tested for women of childbearing age. This vaccine may be useful in preventing cytomegalovirus infection in mother and the infant, and reducing the chance that baby born to women who are infected while pregnant will develop disabilities. Thanks. That is the end of my presentation of my topic cytomegalovirus. Thanks.